Since 2015, we've been hearing from people about their experiences of weight talk and how this affects them. We've also been listening to those who work in health management and promotion to discover how their work feels. We've examined 3 decades of policy and strategy designed to improve population health. And we've looked into spending focused on weight change and its impact on health outcomes. In May 2022, we took some of this data to the House of Commons, where Jeremy Hunt asked us about weight discrimination in healthcare. Everything we do is informed by the lived and living experiences of people, especially the 300 or so that took the time to comment here. Pursuing and monitoring weight change is not having the positive effect on population health that we previously thought it did. So a group of volunteers got together and talked about what needed to change. We discussed the research and evidence that already exists to inform the design of our first Food and Body Ease courses. And some of us went on to test and learn with the course, facilitating one-to-one coaching or in small groups. We used Happiness Pulse to measure our impact, a measure of social and emotional health that incorporates ONS4 and the short Warwick-Edinburgh Wellbeing Scale. And we partnered with accessible Pilates group Mobilates to measure increases in activity over 6 weeks. And this is what we heard afterwards. Robust research over 14 years with over 11,000 participants shows us that it is the beneficial behaviours that we sustain over time that bring health, and not changing BMI, which is also rarely sustainable in itself. The impact of weight talk in the consultation room and beyond. A paper by Shaw and Meadows in 2022 states that weight stigma among healthcare providers is linked to healthcare avoidance in patients, including underutilisation of preventative healthcare and screening. Evidence consistently demonstrates that stigma is more likely to lead to increased allostatic load, higher prevalence of chronic diseases, and further weight gain, independent of BMI. Meanwhile, healthcare systems are still focused on weight change for health improvement, and referrals are being made to weekly in-person and digital slimming clubs. Questioning individual willpower, success or failure, rather than questioning the out-of-reach and unsustainable weight classifications. So we drew on the lived experiences of the evidence base again to co-create the weight neutral training course for social prescribers with formats for time-poor clinicians and the wider food and movement professional workforce, testing and learning as we go. In time, we hope to move a largely weight normative system approach towards a weight neutral inclusive route to improved population health and poor health prevention. The co-production continues with every cohort of weight neutral training and food and body ease participants that come through our door.